Hello, my name is Amelia Lyons and I'm a clinical supervisor and group analyst, and I work for a health board in South Wales. Now, on the supervision programme that I run, the first set of skills that we do are person-centered skills and attitudes. These are things that we learn and that I see as absolutely fundamental and core for our clinical supervisors in the making. And in this short video, I'm just going to draw attention to three what I define as person-centered models of clinical supervision. Now, I define them as that, but in some cases they fall out of the edges of person-centered, and I will explain that as I go. So what I'm going to do is start by talking about a person-centered model of supervision as interpreted by myself. I'm then going to talk about the CLEAR model by Hawkins and Shoei. This is their very first model that they teach before you get into the seven-eyed model. And that's just really to get a fundamental grounding in supervision, get a framework for it. So I wanted to bring that in as it's a nice, simple model. And then I also wanted to make reference to the GROW peer coaching model, which I think is also a helpful peer supervision model. And as coaching has nicked so much off clinical supervision, then I'm going to nick a bit back and talk about it in the clinical supervision context. So, what do we mean by person-centered? That's the first question that, of course, we should be asking. So here we have to thank Uncle Carl Rogers, who was the advocate of the person-centered movement. At the time, the psychoanalytic movement was in its ascendancy, which was quite authoritative. The analyst made interpretations, knew best kind of idea. That's since changed in psychoanalytics, of course, but those days it was pretty authoritative and quite an unbalanced power relationship. Rogers introduced the idea of being genuine, empathic, respectful, non-judgmental in the psychological relationship. And for the facilitator in that relationship being really committed to developing these qualities on an ongoing basis. And I can see that I've said qualifies there. I'm going to change that to a T while we're here. And I'm going to jump down to the fourth point there, committing to one's own self-development, self-awareness, supervision, and sometimes one's own therapy to explore issues that might come up in professional practice in actually the room, the personal room. So that's in terms of person-centered, what's fundamental here are the attitudes. And through these attitudes, empathy, genuineness, non-judgmentalness, Rogers felt that these provided the seedbed for change for the other person. And it's interesting what he says in that little quote there. The curious paradox is that when I accept myself just as I am, then I can change, if you like. Then I have the choice to change. And often in life, of course, we spend a lot of time being quite judgmental of ourselves and not really wanting to look at ourselves because we can get so judgmental. So in a sense, providing that safe person-centered environment in the room to enable the fellow professional to take a look at their practice in a fairly honest and open way, that's a huge task, actually. And it's all about getting the attitudes right. And also the value of being non-directive. So you use all the skills that I'll talk about in a minute to enable the person to listen to themselves, clarify where they are, accept where they are, and then to move forward, if that's what they want to do, at their own pace. So our only aim in this is to really listen to the person and enable them to listen to themselves in a safe environment and understand themselves a little bit more deeply. And if we can do that much with a person, we can facilitate that. That's the job. We must trust in the person's self-actualizing tendency, trust in the fact that they know best. We don't need to make suggestions or give advice to people. We trust that they actually know best. If we can reach that level of deeper understanding, then they're able to move forward. They already know what they want to do if they want to do anything. So we must trust that, and sometimes that can be quite difficult as well. It can be hard to resist the temptation of putting forward some kind of clever suggestion, or we've had a similar situation and this is how we did it. So let's talk about the skills and attitudes that make up being person-centered. So we've talked about, and I've got a whole other tape on what non-judgmentalness, empathy and genuineness mean, so I won't go into those here, other than to say that they are lifelong commitments. They're not an end. They're a process. We work towards being non-judgmental. We work towards being empathic. And we work towards being genuine. Sometimes we find it easier with some people than others, and that may depend on us. It may depend on them, and we're committed to our own self-awareness there, so that we do question why do I feel more empathic to John than Peter? So we take a good, nice, healthy questioning attitude, not overly critical, questioning attitude, curious attitude to our own practice. Fundamental skills, listening. Everybody thinks they can listen, and the reality is most people don't listen very well. Really, really giving attention. Lots of use of silence, not as something punitive, but as waiting, to give the other person space to reflect on where they are. They always need more space than we think they do. Supporting a person, clarifying issues, maybe inviting the person to, can you be a little bit more specific about, give me an example maybe of what you're talking about there, so that you try and get hold of what it is that the person is saying. Reflecting back their feelings and the content of the situation. So often how empathy is demonstrated is through reflecting back feelings that are fairly close to the surface, might be a bit further below the surface, but offering those back in a tentative way to explore and invite the person to consider whether what are they feeling at this moment, and trying to get hold of that, finding different words, really thinking about that and being with them as they're exploring their feelings, which of course might mean being with them when they're actually expressing their feelings. And sometimes that can feel a little bit risky, especially when we're in a professional supervision situation. And yet, of course, we have personal and professional responses to our work, and that's what supervision is all about. It's about exploring our responses to our work, and learning from our practice. Okay, and summarising at the end, that skill, which is very important, where you kind of get hold of what the person's been saying after a little while, and try and give an overall summary. And again, that can help to sometimes nail what's happening. And again, I think of it as a mutual sculpt, really, that you're both chipping away at a piece of wood, and getting closer and closer to what's being said. So often the summary won't get it perfectly right. There'll be a sort of almost a negotiation between two people until it's clear that the supervisee feels satisfied. You can almost see it in their body language. Yeah, that's it. That's what's going on for me. And that whole process, don't try and hit that's it straight away. It's the whole process of getting to that's it is super important, really, to that and what comes out of that. So when we think about the actual model of supervision, then we're thinking about a contract, of course. We're listening and actively engaging into what's going on. We're spending time working on the relationship. We're clarifying the problem situation until we achieve a shared understanding. So we're continuing to clarify. We're distinguishing between thoughts and feelings. We're looking out for themes, because often it's the same old themes that do come up for individuals in terms of how they may help themselves and sabotage themselves in their workplace. And it's listening to yourself at the same time. So as you're listening to how the person is talking, you may offer something like, when you just talked about that situation, I heard quite a strong tone of voice, and I wondered if you were feeling a little bit cross in relation to that. Or you might make a link, like I noticed last week you were also cross about something quite similar. I'm wondering, is there something broader happening in your work at the moment that's contributing to this? So you offer back, and you can also offer back from your own experience in terms of how you're experiencing and being with the person in the room. Because that will often be how they are, of course, with you in the room, is how they are back in the workplace with their colleagues, with their boss, with their patients. So in this relationship, it can be quite important to share some of the feedback that you may have around your experience of the individual in relationship with them. And that can be extremely helpful. So you're reflecting back, achieving the shared understanding. You're all the time reflecting back and inviting the supervisee also to give some feedback back to yourself in terms of, how does that feel? Correct me if I'm wrong. So you're always inviting their feedback on your interventions to try and, again, achieve a fairly accurate understanding, and that overlap between the two of you gets closer and closer. I think of it like two empty vectors coming together and overlapping until the understanding is at its closest. Of course, it's never complete. And then we check the mutual understanding at the end of the session. What are they going away with? And again, quite often that can be pretty revealing, because the supervisee can quite often be going away with something completely different to what you thought they were going away with. So it's always handy and helpful to check that. Leave a bit of time to iterate, and ideally give the supervisee the last word. Then as they go off into the sunset, respect and believe and have faith in their ability to work it out. Respecting their ability, pace, and their self-actualizing tendency, that they will deal with it, and that they don't need you to offer extra pieces of advice. It's all going on for them, and you have to trust that. So that is the person-centered model of supervision, as I would interpret it. Very briefly, that's that one. And now we're going to move on to two other models of person-centered, broadly speaking, supervision, and we can have a look and think about the differences and similarities. So let me just pause at that moment.